Hello and welcome to this special video on supporting loved ones with mental health conditions. Mental illness affects millions of people around the world, and its impact is not limited to the individuals who suffer from it. It affects their loved ones, too. In this video, we will discuss the different ways you can support someone who is struggling with a mental health condition. What is a mental health condition? Before we dive into the ways to support someone with a mental health condition, it's essential to understand what a mental health condition is. Mental health conditions are disorders that affect a person's mood, behavior, and thinking. These conditions include anxiety disorders, depression, bipolar disorder, schizophrenia, and many more. Mental health conditions are illnesses that affect a person's emotional, psychological, and social well-being. They can impact a person's ability to function in their daily life, affect their relationships, and cause significant distress. Mental health conditions are not a personal weakness, and they can affect anyone, regardless of age, gender, race, or social status. There are many different types of mental health conditions, each with its unique symptoms and characteristics. Some of the most common mental health conditions include anxiety disorders. Anxiety disorders are characterized by excessive worry, fear, or panic. Symptoms can include feelings of unease, heart palpitations, sweating, and difficulty sleeping. Depression. Depression is a mood disorder that can cause feelings of sadness, hopelessness, and loss of interest in daily activities. Symptoms can include changes in appetite, sleep disturbances, and thoughts of self-harm or suicide. Bipolar disorder. Bipolar disorder is a mood disorder that causes extreme changes in mood, energy, and activity levels. Symptoms can include episodes of manic behavior and depression. Schizophrenia. Schizophrenia is a severe mental health condition that affects a person's ability to think, feel, and behave clearly. Symptoms can include hallucinations, delusions, and disordered thinking. Other mental health conditions include obsessive-compulsive disorder, OCD, post-traumatic stress disorder, PTSD, borderline personality disorder, and many more. It's essential to recognize the signs and symptoms of mental health conditions and seek professional help if needed. Early intervention and treatment can help manage symptoms and improve the person's quality of life. How to support your loved ones with mental health conditions. Educate yourself. One of the most critical things you can do to support someone with a mental health condition is to educate yourself about their illness. Learn about the symptoms, triggers, and treatments available. This knowledge will help you understand what your loved one is going through and what you can do to support them. Listen without judgment. It's essential to create a safe space for your loved one to express their feelings and concerns without fear of being judged. Listen actively and without interruption. Validate their emotions and let them know that you are there for them. Be supportive. Supporting someone with a mental health condition can be challenging, but it's crucial to be there for them. Let them know that you care and that you are willing to help in any way possible. Encourage them to seek professional help, such as therapy or medication. Take care of yourself. Supporting someone with a mental health condition can be emotionally draining. It's essential to take care of yourself and practice self-care. Make sure to take breaks, seek support from others, and prioritize your own mental health. Don't give up. Recovery from a mental health condition is a process that takes time. It's essential to be patient and not give up on your loved one. Encourage them to keep seeking help and support them throughout their journey. Avoid stigma. Mental health conditions are still stigmatized in many societies. Avoid using derogatory terms or jokes about mental illness, and challenge others who do. Stigma can prevent people from seeking help, and it's essential to create a safe and supportive environment for your loved one. Encourage treatment. Mental health conditions are treatable, and there are many effective treatments available. Encourage your loved one to seek professional help, such as therapy or medication. Help them find a mental health professional who is a good fit for them. Be patient. Recovery from a mental health condition is a process that takes time. Be patient and understanding with your loved one. Remember that their journey is unique, and they may need time and space to heal. Create a supportive environment. Create a supportive environment for your loved one. This can include simple things like checking in with them regularly, providing a safe space for them to talk, or helping them manage their daily tasks. Take crisis seriously. If your loved one is in crisis, take it seriously. Contact a mental health professional or crisis hotline immediately. Don't try to handle it on your own. Offer practical help. Mental health conditions can impact a person's ability to manage their daily tasks. Offer practical help, such as assisting with household chores, grocery shopping, or transportation to appointments. Encourage self-care. Encourage your loved one to practice self-care, such as getting enough sleep, exercise, and eating a balanced diet. Help them develop healthy coping mechanisms, such as mindfulness, meditation, or journaling. Avoid blaming or judging. Mental health conditions are not a personal weakness or a choice. Avoid blaming or judging your loved one for their condition. Instead, focus on supporting them in their journey towards recovery. Respect boundaries. Your loved one may need space or have boundaries around their mental health condition. Respect their boundaries and let them take the lead in their treatment and recovery. Create a plan. Work with your loved one to create a plan for managing their mental health condition. This can include identifying triggers, developing coping strategies, and creating an emergency plan for crisis situations. Stay involved. Supporting someone with a mental health condition is an ongoing process. Stay involved and keep checking in with your loved one regularly. Offer your support and let them know that you are there for them. Seek support for yourself. Supporting someone with a mental health condition can be challenging and emotionally draining. Seek support for yourself, such as therapy or support groups. Take care of your own mental health, so you can continue to be a source of support for your loved one. Final thoughts. Supporting a loved one with a mental health condition can be a challenging but rewarding experience. Remember to educate yourself, listen without judgment, be supportive, take care of yourself, and encourage treatment. Create a supportive environment, avoid stigma, and respect boundaries. With patience, understanding, and perseverance, you can make a positive difference in your loved one's life. In conclusion, supporting a loved one with a mental health condition requires patience, understanding, and compassion. It's essential to educate yourself about their illness, listen without judgment, and offer practical help. Encouraging self-care and creating a supportive environment can also make a significant difference in their recovery. Remember to take care of your own mental health and seek support for yourself when needed. With perseverance and dedication, you can make a positive impact on your loved one's journey towards recovery. Together, we can break down the stigma surrounding mental health conditions and create a world where everyone has access to the support and resources they need.